So while getting into chapter 14 on the cutaneous senses, something that really stood out to me was the topic of pain, because it is something that pretty much everyone in this world experiences, and specifically neuropathic pain stood out to me. I work as a pharmacy technician, and something that I see so often are medications that are dispensed to treat this type of pain. And so I wanted to take a deeper look at this and kind of see what it is, what causes it, what treatments are available, and kind of how it affects people in today's world. So getting started, I wanted to just figure out what neuropathic pain is, and it's defined as a type of chronic pain that occurs when nerves in the central nervous system become injured or damaged. It's also commonly known as nerve pain. And this type of pain can present itself in multiple ways. It can be kind of a burning pain, it can be a stabbing pain. Some people will say it's more shooting. It can be an aching pain. It can even feel more like an electric shock, and also many other ways. Some people say it's more of a pins and needles type pain, and the pain can also be widespread throughout the body, or it can be more localized. And so looking at the causes of neuropathic pain, it's when there's a disease or injury to the central nervous system. So this would include like a spinal cord or brain injury, stroke, which also applies with the poor blood supply to the nerves. When the blood supply is cut off and the nerves aren't receiving that blood, they become damaged and can cause this type of pain. A disease known as multiple sclerosis can cause neuropathic pain, and carpal tunnel syndrome or sciatica, which is where the nerves become trapped, which leads to damage, can cause this type of pain. Something that's huge is diabetes, which is when there's really high blood sugar that can damage the nerves and result in the neuropathic pain. And even viruses too, like shingles or HIV/AIDS, which is huge because anybody that's had chickenpox has the shingles virus inside of them. It's just lying dormant, and anytime the immune system becomes compromised, it can come out and it can cause damage to the nerves and result in neuropathic pain. A disease known as fibromyalgia can cause neuropathic pain, and so many others. Unfortunately, the list is pretty long of all the things that can cause this type of pain. And looking at the prevalence, there was a study done that found that about 3 to 4.5% of the global population suffers from specifically nerve pain. And the global population is pretty big, so even this small chunk is a pretty large amount of individuals suffering from one type of pain. And this study was actually done in 2006, and they estimated that the number would rapidly increase, which means that today it's probably a much larger number of individuals who unfortunately suffer from this type of pain. Luckily, however, there are many treatment options for individuals who suffer from this. Something that I see a lot in the pharmacy are anti-seizure and anticonvulsant medications. These include gabapentin, Lyrica, carbamazepine, valproic acid, and others. And recent research has shown that the anticonvulsants, gabapentin and Lyrica, have fewer unwanted side effects that the anti-seizure medications can cause. For patients who are suffering from isolated areas of pain, they can use topical treatments like lotions, creams, and patches. And some antidepressants have actually had success with treating this type of pain. Some individuals will use painkillers. For more severe cases, they'll use opioid medications. For less severe cases, they can use non-steroidal anti-inflammatory drugs. And electrical stimulation has shown to have success, and this is where they go and they stop that pain message that's going in the nerves, and they can help block the pain and treat the patient. And in more rare cases, they'll do injections of anesthetics, and sometimes they'll even do surgery to treat it. And some people will use alternative treatments, so they'll do acupuncture, they'll do meditation, and sometimes massage will help too. And sometimes people can do lifestyle changes that will help treat their pain. And this is shown to be most helpful where they know the cause and it's a disease that the lifestyle change will help to treat. So like with diabetes, when they implement that exercise and healthy diet and the medications that treat the diabetes, that can help treat the pain that they're experiencing. And this is not always effective, but it can help and can work to lessen the pain. And so looking at this, it was really interesting to just see what this type of pain was and to learn more about the medications that I help to dispense to patients, and see that although it is very common and can be so debilitating, there are many treatment options to help people deal with this type of pain.